Hello there, this is Dr. Dane Donahue, and we are in step 2 of the Wellness Score training process. And we are going to do a webinar today on creating your services that are going to be tied to your wellness score. So if you see here, I'm at the home page of the Cash Practice system, and you have your wellness score over here. You're going to want to scroll down to Wellness Score Settings. And this gives us the 3-step process of creating your personalized wellness score for your practice, including your services. And in step 1, we talked about what do we measure, and that's where we create parameter sets, which are really your wellness score and the individual parameters that you're going to select to create those wellness scores. In this webinar, what I'd like to go over with you is what do you provide? In other words, what are the services that you provide to your patients and that you want to show up on your wellness score? So what we're going to do is click on this button here. There's service groups and services, and a service group is just that. It's a group of services that you're going to recommend when you create your wellness score. And you'll see here for my office, I already have this set up. In our office, we do chiropractic adjustments, fitness trainings, massages, orthotics, and physical therapy. We also do nutritional services that we'll just add to our wellness score. We'll handwrite those in, the products that we want patients to be on. So the first thing that you're going to want to do is add your service group to the wellness score. So I'm just going to put here Main Street Wellness Center Services, and we're going to save that. And that automatically is going to create your personalized service group that you can select when creating a wellness score for your patients. So we're going to save that. And then the next thing we're going to need to do is assign services. Now in the wellness score system, we have services that we've already entered. But let's say that you don't see a service that you provide that's not been loaded into the wellness score. So we have anodyne and chiropractic adjustments, of course, fitness trainings, we have group functional trainings, we have laser, we have massages, meditation, nutritional counseling sessions. All of these have already been added. Nutritional supports, nutritional therapy, orthotics. So all of these can be selected, but you can create a new service. Let's say that we're going to create a service and we're going to call it light therapy. I'm just using this as an example. We're going to then save that. All of your services need to be assigned to a category. In other words, if you're going to add a service, let's say light therapy, you're going to want to tie it back to why you're using that therapy for the patient, what category of their physiology you're taking care of. So when you create that, you're going to see here we've created a new service called light therapy. There it is right there. And what you can do is if you want to go in there and provide a description of the units, maybe light therapy is done in whatever units that you would think for light therapy. If you have a reference as to why you provide that, you can put that here, and then you can provide a description of what light therapy does physiologically for your patient. So that is where you would update your services to include any additional information that you want to provide to the patient. After we create this, what I would suggest is that you need to assign that service to a category. So if you come over to this button here, you'll see that if I click on any of these, let's say that light therapy is something that you're doing for the person's general overall health, right? You're going to want to assign that service to general health. So there's light therapy. So I'm going to click that, and that's going to assign that service to a general health category. So in other words, you're using light therapy to treat the patient's general health. So if we go back here to what we provide, you'll see that we've created our Main Street Wellness Center service group, okay? And now we're going to start assigning services. So let's say that I want to use chiropractic adjustments. And in doing this, again, you're going to work backwards. What I would do is create a list of all of the potential services that you provide to your patients, every single one, chiropractic adjustments, fitness trainings, massage, any service that you provide in your office, you're going to want to load into the wellness score and put that in your service group. Just because you've added it to the service group doesn't mean that you have to prescribe that for the patient when you're creating their wellness score. So you see we have chiropractic adjustments. Let's say we want to add that light therapy. We're going to add that as well. And then we'll add one just for the example here. And then we're going to run a wellness score, and I'll show you where this shows up. Let's say we also want to do orthotics. So I've added 3 services to my service group. And now I'm going to go back and run an exam set. So let's run an exam set. and I'm going to select an easy one, a corporate screening, because there's not many parameters. You would just select the parameter set or the wellness score that you've created. I'm going to select myself. I'm then going to run the wellness score. Now right here you'll see service group. It has the exam date and the service group. So I can drop that down and I'm going to see my Main Street Wellness Center services. So this is where I'm going to, based on the person's exam and their findings, I'm going to add those services to their care plan. So I'm going to put in, first of all, just some examples here for numbers. Say that I was a 90, my medical symptom questionnaire was a 35, and my waist-hip ratio was a 0.9. I'm going to save that, and then based on that, I'm going to want to recommend some care. So let's say for this person, I'm going to recommend 24 adjustments over a 3-month period of time. I'm going to recommend 1 pair of orthotics in that care plan treatment time, and let's say I'm going to do 12 light therapies as an example over a 3-month period of time. I'm then going to save that. And over here, if you remember, this is where you view your patient summary report or their actual wellness score. And I'm going to just enlarge this. And you'll see here that we have the wellness score. So I got an F based on the parameters that I entered in the target ranges. You'll see the categories, that the category that I measured using these parameters was basically general health. The BMI, the diastolic pressure. I didn't use any chiropractic parameters. Had I used posture or range of motion, or let's say I'd used a functional movement screen, that would have showed up in the neurospinal parameters. And then here's your educational piece of the wellness score. We can show a person their overall grade was a 55, and obviously if we improve their general health, their wellness score is going to go up. You know, their health is based on their lifestyle, and these are the 3 dimensions of their lifestyle: their physical, mental, emotional, and chemical stresses. And here's your wellness score recommendations, and I think this is a unique part of the wellness score. Everybody makes recommendations, but this takes their recommendation and makes it unique based on their physiology. In other words, when, you know, as the 3rd generation chiropractor, I've seen a lot of chiropractors, and most people make standardized recommendations. And when you really dig into why they're making the recommendations, there is some objectivity to that. Maybe it's based on their x-rays or their scans. But when you see a whole big picture and you see each piece of the puzzle that comes together, you really can recommend the appropriate service. There's a place to put the patient's name and have them sign their wellness score, which I think is great. And then there's a place here, obviously, to go over the actual individual parameters that we measured. So I'm going to just X out of this and go back here to the wellness score settings. So in working backwards, again, what I would recommend is the first thing you do is write down the services that you provide, all the services that you provide in your office. I'd then recommend going to what do you provide here and creating your service group. And your service group is going to be unique to your office. So again, I used an example of Main Street Wellness Center, but I would use your office name and say that that's going to be your service group, Johnson Chiropractic Center service group. Then you're going to then look at that paper where you've created all the services that you provide, and then choose those services and add them to your service group, which, if you remember, if we go back here, that's where we assign the services. So after you create that, you assign those services. Make sure that the services are assigned to a category. In other words, again, if we go up here, we want to make sure that those services are assigned to one of these categories. So this is where you go here and you say, okay, the service that I created, I want to assign that to a category. So you're going to assign light therapy to general health, or nutritional therapy obviously would probably go towards biochemical health. So you were just going to assign that service. So that's an overall tutorial of the Step 2 process in creating your services. For any additional questions, please contact us at Cash Practice, and we can answer your question.